Assalamu alaikum and hi everyone, welcome to this presentation of collection, transport and processing of urine specimen. In this presentation, the topics that will be covered are as follows: the introduction, types of urine collection, type of container as well as transportation and storage before processing. Urine is one of the most frequent specimens sent to the laboratory for related clinical diagnosis. Its result depends on the collection method, time of collection and handling. Ideally, the first morning voided urine should be collected. If this is not possible, urine should be incubated in the bladder minimum of 2 hours before collection, especially in patient with indwelling catheter. Types of urine specimen collection are divided into two categories: the non-invasive and invasive type. Midstream urine, MSU, or clean catch urine and tapping procedure are in category of non-invasive type, whereby the catheters and suprapubic aspirations are in the invasive category. The first type of urine collection is the midstream urine, or in short form, MSU. The purpose of MSU is to get clean catch of urine. For the preparation before procedure, for female the periurethral area has to be cleaned with water, hold the labia apart and then begin voiding. For male, the glans penis has to cleaned with water and retract the foreskin and begin voiding. Discard the first part of the voiding urine in the toilet bowl, and the midstream urine part is voided into the universal sterile container. Collect at least 5 ml of urine. This is an example of an illustrated poster for the proper steps of MSU collection. Next procedure is tapping, a method to stimulate urine flow in a baby. The steps are as follows. First, tapping approximately just 2 fingers above the pubic bone an hour after baby is fed. Second, 1 tap or second or rub with cotton swab is done for 1 minute, an interval of 1 minute is allowed, and done repeatedly. Urine is then collected in the sterile container. Another method is by using catheter. This is an example of straight, in and out, catheter. First, patient's urethral area is clean with water. Then the catheter is inserted into the bladder via the urinary meatus, and urine is then collected. The other method is indwelling Foley catheter, which is done in patients who are unable to produce adequate midstream sample, or who are not able to pass urine by themselves. This is done under aseptic technique. The urine is collected front the proximal catheter tube or port via a needle syringe. Urine should not be obtained from urinary bags to avoid contamination. This video shows an example of urine collection from the urinary catheter.
This is an example of indwelling Foley catheter inserted to a urinary bladder and attached to a urinary drainage bag. So, urine sample from the catheter is taken via a needle syringe from this urinary catheter port, whereby urine sample cannot be taken from this drainage bag as it might be a risk of contamination.
The last method is the suprapubic aspiration. It is an invasive procedure performed primarily for pediatric cases. However, it also can be performed for adults with certain condition like comatose, urethral stricture or trauma, and periurethral infection or phimosis. The procedure is done under aseptic technique, with the needle puncture directly on the urinary bladder just above the pubic symphysis. Then urine is aspirated with a sterile needle and sent to the laboratory. Next topics are on the appropriate collection, transportation and storage. Urine is collected using a sterile container which is labeled and has to be sent immediately to the laboratory or within 2 hours of specimen collection. If this is not possible, sample has to be kept in refrigerator at 4 degrees Celsius. If there is any delay expected, it may be transported in a container containing boric acid, which to prevent overgrowth of organisms during transits. Urine and boric acid must be kept at room temperature and can last up to 48-96 hours. We have come to the last part of the topic presentation. I hope you can take some time to answer these questions related to this topic. Thank you.